and welcome to And So Much More. I am your host, Cami Smith, and you all should be familiar with Dr. Engel at this point. This is Dr. Travis Engel. He's the chair of pediatrics here at Centra. Thank you so much for joining us again.
My pleasure to be here. Yeah. Always fun.
You've been our voice of reason into all things pediatrics and for all of us parents who are listeners who are watching. And so what we want to dig in today is those first, and you said this so well, the first 24 to 72 hours after you have had your baby and you are overwhelmed and there's this huge checklist before you of what you're supposed to be doing, what you aren't supposed to be doing. And we need clarity. Like, you want that voice of reason. And there's also some cool changes and some things that are happening here at Centra. But why don't you tell us a little bit about like some of the changes that are happening, but then also some of the information you were sharing about before we turned our camera on.
Yeah, so I think first and foremost, what I really want parents to know and what I really emphasize when we go in for our first visit with parents after they've had this lovely newborn is there's so much information that can be overwhelming.
Yes.
But the vast majority of babies are born healthy and don't need a lot of intervention. We do a few things to keep these babies safe. These are the recommendations we make. But overall, a lot of babies, we're not overly trying to intervene with them. So
yeah.
For the most part, we like to talk to parents about in the first 24 hours, we have kind of low expectations. Let's keep everyone safe. Let's keep everyone comfy. Let's really promote a lot of bonding. And then we start talking about what happens after that in the run up to kind of going home and what the care looks like in the next few weeks, which are really critical for the baby's growth. So
yes.
One thing we talked about earlier, and just to kind of back up and take a 30,000-foot view, is every baby born here at Virginia Baptist will be seen by a pediatrician or a pediatric specialist. Whether that is the pediatrician you picked, you have other children who are already seeing a pediatrician at one of the local pediatric practices, or there's some practices that don't have pediatricians who round in the hospital. That's where our group steps in, the pediatric hospitalists employed by Centra Medical Group. We have a wonderful team of 3 pediatricians and 2 nurse practitioners who will round here at Virginia Baptist Hospital for all newborns. So I think it's a lovely resource we offer to the community that every child born here will be seen by a pediatrician or one of our specialist nurse practitioners who are absolutely wonderful.
Yes, and they really are. And I want to give some context because you think of how many babies are born at Virginia Baptist. It is a huge number. And so when you say three pediatricians and 2 nurse practitioners, that doesn't sound like a lot. But when you think about at any given time how many babies are on the unit, that's more than enough to cover the necessary face-to-face visits that happen. Yeah,
we have about 2,500 to 3,000 babies born at Virginia Baptist every year, last I checked. And 80% plus of those babies will be seen by our group, and it is such a privilege to be able to do that. So I say that with a smile. It kind of makes my hair stand on end that so many babies born in this area are seen by us, and we get to be that first kind of touch of healthcare for them. It's such a really sweet moment for these families. So
it's true. You know, it's interesting. I had both of my babies here, and every time I drive by, like, I just have such great nostalgia. Like, it's just a really sweet environment for people to get to be a part of. And so in those first 24 hours, let's start there. What does that look like?
Well, I think the first 24 hours actually starts almost 9 months before, when you have your relationship with your OBGYN and you're doing all of that preparation and lead up to delivering your baby. Things that need to be discussed prior to delivery about what happens in that first 24 hours involve the mom's health care a lot. Has mom gotten all of the routine health care she needs? That's things such as vaccines, prenatal screenings, prenatal ultrasounds, and then also some decisions to be made about what mom wants to do right after baby's born. One of the first things we like to do, not in the first 24 hours, but ideally in the first hour, is to allow mom the opportunity to breastfeed if that's her choice, if that's how she wants to feed her baby, to promote that bonding. We're very big on promoting breastfeeding attempts in the first hour of life and allowing for skin-to-skin contact and bonding. And we don't let anything except for the most emergent conditions really stand in the way of that.
Yeah, I love that.
In addition to that, shortly after baby's born, we really advise 3 things. First, erythromycin eye ointment, which is an antibiotic prophylaxis for certain conditions or bacteria that may be present in the birth canal that can cause blindness.
Yes.
The rate of blindness caused by these bacteria is essentially 0 now because we do this.
Okay.
The chances of that happening without the ointment are actually still pretty low, but I think of things that are lifelong conditions like blindness.
Yeah.
And again, not to be sentimental about it, but I think of a lot of the moments I enjoy with my children and talking about looking at things and reading books and stuff like that. To imagine that my child might not have their vision intact is pretty scary to me.
For something that there is actually treatment
for something that is all universally treatable, and that the rates of blindness have gone to essentially 0 because of this. So in addition to the erythromycin eye ointment that we talked about, we also do a vitamin K injection. And vitamin K is necessary for clotting in all humans. The problem with vitamin K is that it's primarily synthesized in the GI tract. And babies have a sterile GI tract. For the first really 6 months of life, they're building that gut microbiome that we really focus on. And those bacteria help synthesize vitamin K in addition to certain activities by the liver that's immature, right? So not a physiology lesson by any means, but what I want to emphasize is that babies' vitamin K levels are physiologically low for the first 6 months of life, which puts them at significant risk for bleeding episodes.
Oh, wow. And that's so scary as a parent when you don't understand the why behind something. This is so vital.
And so it used to be called hemorrhagic disease of the newborn. It was so common 60 years ago that they had a name for it.
Wow.
And we began administering vitamin K, and the rates of severe hemorrhage in newborns have virtually gone to 0 because we provide that.
Yeah.
Again, it was not universal that every baby who didn't get a vitamin K injection would bleed, but the devastating effects of any child who bleeds because of lack of vitamin K are present and should be considered. So about 3 out of 100 babies who don't get a vitamin K injection will have a bleeding episode.
Wow.
Many of those bleeding episodes are not noticed by parents because they happen in ways that we don't see. This isn't things like GI bleeding where you notice blood in the diaper or something like that. This can be things like bleeding into the head, like a stroke, essentially, that we don't see until it's too late. 1 in 5 babies who have a bleeding episode will be potentially neurologically devastated or have lifelong effects.
Wow.
That's why it's really critical and something we talk about a lot. You know, there is a lot of discussion on vitamin K and a lot of skepticism, I think, in recent years regarding vitamin K. Some of the issues that come up are it's linked to development of certain childhood cancers, toxic heavy metals, things of that nature. I really want to reassure parents, and this is a whole separate discussion, but I want to reassure parents that number one, vitamin K is safe. No one on our team would ever recommend anything for a child under our care that's not safe.
Yes.
The same type of care we'd recommend for our own children is a standard we always have. Number 2, there's no link to increased childhood cancers. And number 3, it's not an immunization necessarily. There's no concern for preservatives, thimerosal, mercury, things of that nature. And then number 4, the risk of not getting it is significant, unfortunately.
Yeah.
So we talked about erythromycin, vitamin K, and then hepatitis B immunization. One of the baby's first ways we protect baby from communicable diseases, hepatitis B immunization. Hepatitis B has been on the rise recently, especially with the opioid pandemic, the increased use of injectable illicit drugs, stuff like that. It used to be something we really only considered in healthcare workers. Yeah. But now we really feel like the ability to prevent hepatitis B acquisition with a safe, effective immunization provides a benefit to children that can prevent potentially chronic hepatitis or chronic liver dysfunction. So the main benefit is seen if that's given within the first 24 hours. The immune response generated is best within the first 24 hours. Ooh,
that is a lot.
That's a lot.
You see that printout, you know, as someone who has been in here and has had a lap full of paperwork.
Right.
And it's so good to just have some like a voice of explanation behind what I'm looking at. Because yes, you can read about it and try to understand it a little bit, but there's just so much to better understand it. And so I think this puts some things in a little bit of a more layman terms for us to understand.
I feel for parents, right? The time for this discussion, again, like I said, the preparation for the first 24 hours can happen 9 months before.
Yeah.
The time for this discussion is not when parents are physically exhausted, emotionally drained, and also wanting to enjoy some bonding with their baby.
Yes.
I'm happy to have it then, but I feel like it's not as effective sometimes.
Yes, that's when like the skin to skin, like just enjoy that moment.
Yeah.
Yes, I love when you said, you know, the first 24 hours starts 9 months before. And I think that might be a really important message to just kind of spread throughout our community, because I was one of those, I was a transplant to Lynchburg. And so I didn't know what was offered here. I didn't know really what my first steps were when I found out I was pregnant. So now as a caregiver here at Centra, and knowing and hearing about all that is available as someone who's pregnant, you know, headed into this huge journey for the rest of your life, and being able to prepare for that. I mean, it's so invaluable to know what is at your fingertips, because it truly is. There's so much for parents here at your fingertips as far as better understanding.
We have such a individualized approach and ability to provide individualized healthcare to every patient who walks through our doors, because we are a facility that is, or an operation and an organization that's big enough to provide really great care, number one, but not so big that we lose the individual feeling that we want patients to get when they come here for something as special as delivering your child here at Virginia Baptist, right?
Yes. So what about that immediate post, like discharge from the hospital? Yeah.
So again, the first 24 hours have pretty low expectations. There's a couple boxes we want to check. We want to make sure we launch you on your breastfeeding journey if that's your choice. We want to make sure baby is doing some feeding attempts, and we want to get that care that I discussed earlier done. Then on day 2, we start to discuss, all right, here's what discharge looks like, and here's the steps we're going to take to get there. First and foremost, what I want parents to really consider is, if you don't have any other children who already see a pediatrician, we're going to want to know who your pediatrician is going to be. Or your family practice doctor, for that matter, who are also qualified to see children. The reason is we want to start really considering, when are we going to make that first follow-up appointment? Where are we going to send our records so that individual has all the information they need to treat you and your child? Number 2, on day 2, we really don't do a lot unless it's day of discharge. We want to monitor baby's weight. I expect all babies to lose a little bit of weight before discharge. It's totally normal. But if that weight loss is starting to get excessive, close to 8 to 10%, we start watching really close, and that'll inform when we want your baby to follow up. So we look at weight. We'll do a hearing screen on every baby. So every baby gets their hearing screened. It's not uncommon for some babies to fail their first hearing screen because of amniotic fluid in the ears or something like that. So we also want to do that early enough so we have an opportunity to repeat that hearing screen if we need to. And if for some reason that repeat hearing screen doesn't go as planned, then we'll get you scheduled for a follow-up here at Virginia Baptist. Because we can offer that service to you. Number 3, every baby before they go home will get what we call a critical congenital heart defect screening, or CCHD. They call it the heart test sometimes, or cardiac screening. There's a lot of different names. It's mandated by law in the state of Virginia and multiple other states. And what it does is it checks the blood oxygen level in the right upper extremity compared to the blood oxygen level in any other extremity. And because of the way the baby's heart transitions from when they were in your womb to when they are born, if there's a way that the blood is mixing in the heart, such as like a hole in the heart, for example, that causes the blood oxygen level to be dramatically different in those two areas, then we want to do further investigation. It can be a sign that there might be a problem with the heart. So that's a really simple explanation for that. And then 2 more things, all right? We do a bilirubin test. Bilirubin is the substance that causes jaundice or yellow skin. Every baby at baseline has a physiologic level of jaundice. Their bilirubin level much higher than you or I for a number of reasons: immature liver, increased red blood cells, etc. We want to make sure that that level is not dangerously high. That can cause brain damage. I did not know that. The amount of brain damage we see from high bilirubin now is essentially 0. because we test for this.
Which is probably why I didn't know that.
Yeah, exactly. It's something people don't know about, but these things happen and we kind of just assume it's like, oh, well, this is great. We'll just kind of check it out, it'll happen, etc. But there's actually a big reason. If that level's kind of on the fence or riding the line from like, it's okay, we don't need to follow it, or we need to follow it, we'll get you scheduled for a follow-up appointment, either here at the newborn follow-up clinic to have that level repeated to make sure it's not rising dangerously.
Yeah.
Or we'll at least inform your pediatrician or your follow-up caregiver that they need to check it.
Okay.
In some cases, that level is so high that we need to intervene immediately, and we do something called phototherapy for that.
Okay.
We have the ability to do that here with the baby in the room with mom and promote breastfeeding while we do that. Wow. And then last but not least, we also do what's called a state newborn screen, or NBS. This used to be called the PKU because it the original condition it tested for was phenylketonuria.
Okay.
But now we test for over 30 different conditions in the state of Virginia, which have a huge impact on lifelong development and well-being of the child.
Okay.
30 different conditions that are metabolic, genetic, or inherited that if caught early can be treated or at least some of the negative effects mitigated.
Wow.
Conditions that if we wait for them to become symptomatic, often are too late to intervene in.
Yeah.
So that's why we send this test before baby's discharged. It goes to the state.
Okay.
And the state will contact the pediatrician for that patient. It's another reason we need to know who you're going to see, who your baby's going to see, and inform them of the results.
Okay. So what are some of those things that it tests for?
Yeah. So common things that you've probably heard of that it tests for are things like cystic fibrosis, sickle cell anemia, things of that nature. There's also some less common things that it tests for. Phenylketonuria, medium chain ACL carnitine deficiency, disorders of metabolism, severe combined immunodeficiency disorder, things that, again, by the time they manifest clinically, by the time the pediatrician or the parents say, I'm worried about my child, I'm seeing something going on, it may be too late. We would have wanted to know earlier. We might have been able to prevent some of that.
Yeah.
So again, the list is, I don't want to say exhaustive, but 30 plus conditions, and the ability to capture these conditions early is significantly impactful for your child's health.
So how are these tests conducted? Are they drawing blood or?
Only 2 of the tests that we conduct require a heel stick and a blood sample. That's the bilirubin, the jaundice level, and the state newborn screen. That's 1 heel stick where we collect the drops of blood for both of those tests. Okay. That's done after 24 hours of life and before discharge. Okay. The other tests are all non-invasive.
Oh, great.
They require someone to come in the room to perform the hearing screen or the critical congenital heart defect screening, but they're non-invasive. They don't cause any pain or distress to baby, anything like that.
Okay. I think that hearing about all of this, it kind of sheds light on how vital those first few days really are and how much you can learn. I had no idea what was gleaned right off the bat for preventative purposes. Yeah. It's crazy.
All of this is in addition to the daily physical exam and interview, kind of history and just going over how everything is going that you'll get from the pediatrician or our specialist nurse practitioner on our team. So we check in with you every day. In addition to the information that we can provide and the help we can provide to promote breastfeeding, feeding your child, and just the overall well-being of the family while you're here, and hopefully launching you for success when you leave the hospital with an additional person you didn't arrive with. So.
Yes, it's a little unnerving. We joked about this before we started filming. You know, especially when you have your first baby and you have all this information. It really is so much that you learn right off the bat. And you've prepared on some level, but you know, they allow you to just leave the hospital with this beautiful new person, and it's so overwhelming. It's like, wait, I can just go? So like, it's unnerving a little bit, but yeah, it's comforting to know how much work has already been done.
Yeah, and I think the vast majority of babies born are absolutely, well, all babies born are perfect. Yeah. The vast majority of babies that are born have no medical conditions or anything we have to intervene on. But we check for the small minority of babies that do. Yeah. Because it's so important to capture that.
Absolutely.
With that being said, we The job we have in this hospital to take care of those newborn babies, we take very seriously because we know how much the parents love those babies, and we want for them to be healthy and safe when they go home. So it's such a privilege.
Time, to look back and have those memories of a care team that truly cared so much.
You talk about being overwhelmed and everything, and I sense this often when I come in the room with these families. I have sensed it myself as a parent too, on the other end. Even when I was a pediatrician, my wife was an ICU nurse. I mean, there was a lot coming at us.
Yes.
So even for healthcare providers who are familiar with this, it's a lot. I like to tell parents, for the most part, love on your baby, keep them safe, feed them. We'll take care of the rest. We'll catch the rest. All right. Yeah. And in the vast majority of cases, there's nothing else for us to help you with other than making sure we give you all the tools to do those 3 things you need to. And I think that's a really sweet way to put it, because at the end of the day, sometimes when we're in the moment of having to do all these things, I can lose sight of how important and how meaningful and how much of a special time this is for families.
Yeah.
That I like to kind of reground myself in that idea that, like, just love on them, keep them safe, keep them fed.
Yes.
We'll take care of the rest. Don't worry.
I love that. And that's a great place, I think, to end. I do want to ask you, is there anything else that I haven't asked you that you do want to share?
Oh my goodness. No, other than just to say thank you to the community. I'm going on my 2-year anniversary here as the chair of Peds. And just what a wonderful community to work in. What a special place and special job I get to see all these babies and take care of y'all's children. So I appreciate that.
Yeah, absolutely. And thank you for coming on. Again, hopefully we'll get to see you more.
Yeah.
And thank you those who are listening for joining us on And So Much More.